Welcome to the CRACKINBACK Podcast. Today we're diving into the shocking truth, breaking traditional thoughts about heart health with Dr. Howard Elkin, a leading functional cardiologist. Discover why even the fittest are at risk and getting his controversial take on statins, cholesterol, COVID, and artificial intelligence in medicine. Don't miss it. Just to start out, well, we welcome you. That's number one. And to start out, we would love for you to explain what a functional medicine cardiologist is all about. What is that? And explain that to the audience.
Great question. First of all, thank you very much for inviting me to speak. Okay, so I kind of describe myself as an integrative cardiologist practicing functional medicine. So functional medicine to me is going above and beyond. In other words, if you look at traditional medicine the way I was taught, okay, you have symptoms and then you have treatment. That's it, right? But with functional medicine, you have symptoms, you do have treatment, but in between something very important called cause. What is the cause of this problem? What is the cause of this symptom? So we try to locate, we try to get at the cause, and that helps us to give more specific or better enhanced treatments. So functional medicine is really going above and beyond. That's kind of how I paraphrase it. Now, an integrative cardiologist goes outside the box. Like I was traditionally trained, right? And so if you look the way I was trained, I give this example all the time. When I was a fellow in the 80s, everything we knew how to treat women was based on studies with middle-aged men. So already we were at a loss, and that's how we treated back in the 80s and 90s. So things have changed. So integrative, I do specialized testing. So I tell people as an integrative cardiologist, I really don't care about your numbers. I mean, I do, but I don't. I don't care how your cholesterol, but what I'm more interested in is figuring out what is your risk? What is your risk? So I treat your risk as opposed to your numbers. And like, for example, if the cholesterol is elevated or even high and the patient's low risk, why would you want to treat? Why would you need to treat? You don't. So I do a lot of different testing, including various scans, we can go into later if you want, to really help get at the actual risk of the patient. So I'm not just treating blindly. I'm not just putting a Band-Aid. I'm actually really trying to hone in on the problem, the cause, and I treat from there.
Well, we love what you do, and we're just more importantly fascinated as to, and if you could explain why your peers are stuck in the 70s, 80s, and 90s in the way they treat.
I don't get it. I mean, I have the same training they have. I took it to a different level because that's just who I am. I've always been inquisitive and want to learn more. I mean, I had 1 hour of nutrition in medical school. Can you believe that? 1 hour. Yet one of my major interests is nutrition, sports nutrition, cardiac nutrition, anti-aging nutrition. So, I did an anti-aging medical fellowship at the American Academy of Anti-Aging Medicine that helped broaden my skills. So I don't know why these guys are stuck. For example, I'm doing a new scan now called, this is really interesting, it's called the Clearly scan, Cleerly. I don't know if you guys have even heard of it. It's not really appreciated by my peers, but for the first time in history, we can differentiate between a hard plaque and a soft plaque. And in between, there's something that's very potentially dangerous called low-density soft plaque. That's the kind of plaque that breaks off and causes heart attacks and strokes. Now, we can finally delineate that with a special scan. We do a CT angio, and then we add artificial intelligence. And the results are amazing. I've done about 25 of these. I'm becoming kind of an expert at interpreting the results. So I told my colleagues about it. This is the patient you want to stent. Not just stent a 90% blockage, because that could be there for years. It's stenting something that is low density, friable, which can cause a heart attack. And they say, well, but the blockage on angiogram is only 50%. And this is the oxymoron part of it. Most heart attacks are 50 and 60% lesions that become vulnerable, and then a blood clot happens and you have an event. So we will be able to eventually minimize some of the cardiac events that we see on a daily basis by knowing the composition and the volume of the plaque. It's a brand new scan. My colleagues don't get it. And I understand because there's two things that are missing. We don't really have guidelines yet. We need to develop guidelines for who should get the scan, who shouldn't, and we need to have insurance reimbursement. A lot of my patients are paying out of pocket just to get the scan done. Or the Medicare or PPOs will pay the CT angio, and then Harbor UCLA, that are very good to me, they'll throw in the Clearly for at pro bono. But that's not going to happen for everybody. So this is just one example in which I think I'm better or smarter than the average cardiologist. I have the same training. I want to know more. I want to hone in on the problem and treat the problem, not the number.
Oh no, I think it's fascinating that you must be always questioning what's out there that can be improved upon, whereas a lot of your peers are stuck. They learn one way and they don't question, is there another way of doing things? If you don't mind sharing, I would love for you to, talk about your experience with a heart attack and why would that happen? And what did you do to help?
When I presented to Senior Sinai, they said, you don't fit the profile of a person with a heart attack. But you know what? It can happen to anyone. So this is several years ago. And this is the opening of my book, by the way.
Nice.
This is my book. We'll talk about it after. But anyway, I woke up at 3 a.m. with like heartburn, which I never get, okay? I went back to sleep. I woke up at 6 a.m., the same thing. I got a little worried at that time, so I paced the floor, but I came back and did some meditation, went away. Make a long story short, I went to work on it was a Thursday, I believe, and I developed, I broke up in a cold sweat, around 11 a.m. I said, Heidi, take an EKG on me, and it was normal. So then I did the next, I'm only worked half day back then on Thursdays. So I said, okay, I think I'll just go to the West Side and go work out at Gold's Gym with my trainer. I mean, that's a smart thing to do when you're about to have a heart attack, right? And I did that. And then my trainer said, Doc, you don't look too good. You okay? I said, I'm fine. So I swear to God, after my training, I did those ubiquitous ab benches. And all of a sudden, my arms felt like they were 50 pounds each. I never felt such heaviness. Now, this still isn't clicking, guys, okay? Now, I'm a cardiologist for several years. And I say this because I was a typical male. And I went to the firehouse to get something to eat, and because I hadn't eaten all day. And then the sensation came over again. I called my best friend, Barry. I said, Barry, something's really weird happening. My arms were like they're 50 pounds each. He says, Howard, your arms are 50 pounds each. I said, Barry, this is not funny. He said, Howard, you should be calling your doctor, not me. So I called my doctor, and he said, get to the emergency room at Cedars right away. I said, are you sure? He said, are you freaking kidding me? It would look really stupid for a cardiologist to drop dead of a heart attack without being evaluated. That was my story. So here I am, this board-certified cardiologist with all this knowledge, and all of a sudden when it came to me, I was clueless. And that's after that event, my daughter came to pick me up. She says, Dad, it's time to write your story. Now, my story evolved a lot since then. That's when I started. This is 15, 16 years ago. So, I didn't mean to get off topic, but I have to.
That's great.
It's such an interesting backstory, but that was the impetus for me to become my own medical advocate. Because what happened when the cardiologist came to discharge me? Now, this guy was probably 15 years younger than me, and was like about 270 pounds, and it wasn't muscle. Okay. He said, Dr. Elkin, I don't know what to tell you. When it comes to rehab, you're on your own. I said, okay, I can handle that. I've officiated cardiac rehab programs. He said, but one thing that I'll never forget this. You have a new stent, looks great, everything's going to go great, everything's going to do well. So he left the room, and I said to myself, this BS is absurd. Because if I'm so great, and this is going to work out wonderful, why did I have this to begin with, right? And what should prevent it from coming back? Now, keep in mind, I was a bodybuilder. I've never been overweight. I've never smoked. I've always had good cholesterol. I've never been high blood pressure. No family history. But I had an amazing amount of stress, which is all outlined in my book. And what I wasn't really dealing with at that time was the stress. So then I started dealing with that. And then 19 months later, I ended up in the hospital for emergency back surgery. And that was much more serious than the heart attack because it had permanent nerve damage as a result of this surgery. In one clip of a knife, and I ended up with severe nerve damage that I'm still dealing with 16 years. Actually, the Friday the 13th. This is the 13th, isn't it? It was a Friday back when I had that happen. So that's when I really learned that I had to really step up to the plate and take care of myself. And that's when I really became I had a good friend, a speaking coach. He said, "You are the medical advocate. That's your branding." I said, "What do you mean?" Because you had to learn on your own how to take care of yourself and to step up to the plate. And this is what you want your patients to do. And that's what I've been doing ever since. By doing the testing that I do, by doing the teaching that I do, by encouraging patients, not belittling them with jargon they don't understand, by talking to them on their level. I've had great results with patients, and the book really, it starts with my story, but it's really more about how you can become your own medical advocate by taking charge. It's all about taking charge. So that's my story.
That's fantastic. That's fantastic. No, thank you for sharing. It's always struck me, and my curiosity as to how so many bodybuilders and endurance runners just drop dead from cardiovascular disease when they are like the image of health. And if you can, share some of your thoughts
It's
on
called,
how that happens.
yeah, it's called excess. Before I got into bodybuilding, I was doing marathons, and I'm really a strength athlete. That's really my forte. But I was doing marathons, triathlons, and then I said, well, what I'll do next, this is me, OCD, I think I'll do the Hawaiian Triathlon, the great,
man.
what's 3.5 mile swim, a 100-mile bike ride, and then the marathon after that. And then I started reading that. I saw people like going to the finish line and almost just dropping dead, but some did. And they were doing endomyocardial biopsies after the race 6 weeks later, I think 4 or 6 months later, and then after that, there's like permanent scarring on the heart. So when you exercise that extreme, you want inflammation. Inflammation is part of exercise, but not excessive, because we know that excessive inflammation is going to lead to all 4 major diseases of aging: heart disease, cancer, autoimmune disorders, which are on the rise, of course, and Alzheimer's. So it's excessive. Bodybuilding is a whole different topic. I actually profiled this, did an Instagram post and a blog about, I think it was November of 21. At that year, there were like 20 professional or very high-level bodybuilders dropping dead. A lot of it's drug-related. A lot of it is training, excessive training. One I profiled had rhabdomyolysis from excessive training and dehydration. It's not a healthy lifestyle. When I did it, I competed for several years, and I drew the line as to what I would do. But I did crazy stuff. I would lose 30 pounds in 12 weeks. That's crazy. I would never recommend anybody do that. But when you're trying to win, you do those crazy things. So I think the answer is that excess, whether it's endurance, whether it's strength training, you kind of bypass the benefits of exercise by doing harm to your body and shortening your lifestyle.
Yeah.
So, I just wanted to mention, I read that article. I read through I love your blog, and I don't read blogs. I ate that up. The way you put a couple things and had some research behind it and everything. Thank you. I just wanted to make
And
mention.
as you can tell by the partnership,
Yeah.
I'm the bodybuilder of the two. And that is my partner. You just nailed him to a T. I got to ask something, because you mentioned about the stents. You mentioned about what you had in the plaques. But there's in our world, there's another drug that is very controversial. And we've had docs here talking, there are and we're talking statins. There's, doctors pro-statins. There's doctors anti-statins. There's skepticals who are saying they increase muscle problems, blah, blah, blah. What's your position on statins?
great question. I think there is use for statins in the right population. I think some people that should be treated aggressively aren't, and the majority of people that are being treated don't need to be. I think it's overutilized, like I said before. I don't know if you guys heard, there was an article that came out about 3 weeks ago. I have to get it, I'm going to try to profile it. But there was an article that came out, I think it was the British Medical Journal, anyway, a British Heart Journal. So they studied all these patients, and they said the ideal cholesterol, or LDL cholesterol, should be about like between 99 and like 170. Now, what they carefully said in that study, which of course the media did not mention, was that they excluded diabetics. They excluded patients with known heart disease or anyone within a previous event. So, and I agree, I have never treated people that don't have coronary disease with statins. I just say, okay, work on diet. We can jar supplements. I'm really not worried. When the LDL gets over 190, I get a little concerned because once you have an LDL of 200 or more, then you're talking about an entity called familial hypercholesterolemia, and that can predispose you to heart disease. But that's excessive high, So, a lot of patients are being treated with statins, LDL 130, 120. You know why? Because Quest says it's out of range. So we should treat it, right? But there's no data behind it. So this study really kind of solidified what I've been doing for years, treating the right population. Now, what about those with heart disease, like me, okay, with a previous heart history? Okay, so we know from the 4S studies and a lot of studies from the 90s that people that have had a previous event and or have coronary disease or have multiple risk factors do better with statins, okay? They have less of a second event, and that's important because we want to prevent, and these people, that's secondary prevention. And someone like you, not me, it's primary prevention. There's a difference because the treatment is different. But what got really, really angry about this article, well, not the article, about the media took this and said, oh, well, doctors are prescribing statins when they shouldn't be, and it's malpractice. And so they're taking it out of context. So yes, statins are overutilized, and I don't believe in using them unless you need to, unless you have a true indication. But I don't want to just diss them because a lot of people on social media are saying doctors are wrong, cardiologists are wrong. See, I don't like the doctor bash unless I really have to, since I am a doctor. But I like to give both sides of the story. So I try to say the long answer to your question, it really depends on the population. Yes, I do use statins, but I'm very selective about who I use, what I use, and I also try to minimize the dose. And anyone in my practice that goes on a statin automatically has to take CoQ10 because statins do a good job of decreasing LDL production in the liver, but they also decrease coenzyme Q10 in your muscles. And that's why muscle aches and pains and myalgias are the #1 complaint that you hear from people taking statins. So I don't even wait for that. They automatically
see,
have to
this is stuff I love,
CoQ10.
and I want to just, before I ask the next one, I want to emphasize, you'll get these people that have bad lifestyle habits, overweight, they had a heart condition, and the cardiologist will put them on statins instead of going after the why they got the heart in the first place. They don't work on their diet, they don't work on the lifestyle. And I like what you're saying, where let's work on that first, and then after that's done, if we still need statins after our tests and all that, now we can engage that. Instead of making it the primary course, we'll put on as a last resort type of thing. Is that correct?
Right. Yes, and let me give you a prime example. When I was doing procedures for 37 years. I stopped being on call April of 23. I mean, when you're on call as a cardiologist, that means anyone that comes to the emergency room and the throngs of heart attack, your responsibility is get there with your cath lab team and do whatever you can to open that artery and put a stent in, which is basically, it's life-saving, but it is a Band-Aid. We aren't doing anything about lifestyle. And then when they come to my office after the procedure, I say, okay, now the work begins. Because this is not going to remain, you got a new, not like my doctor told me, you got a new stent, so you're going to be fine. No, I don't say that. You have a stent. Now this is the time you have to really get to work to prevent a further recurrence. And that's how I started. Now, but so now that I'm not doing procedures, I see people coming to me after their heart attack, after their stent, and I can guarantee they're going to, it's like almost, it's just like what's going to happen. They're going to be discharged on the highest dose, 80 milligrams of Lipitor, the highest dose statin, beta blocker, ACE inhibitor, aspirin, and an antiplatelet agent. So they're walking out with 5 new medicines, but they're probably taking nothing beforehand. It's almost, I can guarantee you, anyone that comes to my office that was just discharged with a heart attack, they're going to be on all those medicines and on high doses. And they feel like crap.
Right.
And I can understand why, right? So it's just one size fits all. That's how I look at traditional medicine versus functional. One size fits all, but it doesn't work. It can't work. You know, I remember several years ago, I was discharging a patient at the hospital that had heart failure. The discharge planner, Dr. Elkin, did you forget something? I said, what do you mean? Did you forget to order an ACE inhibitor on Mr. So-and-so? I said, no, I didn't forget it. I just didn't do it because I didn't think it was needed or necessary or even warranted. Well, your chart's going to fall out of compliance because according to the clinical guidelines, I mean, I literally had to go back to that chart and describe why I didn't want to order a specific drug. But just because it's always done doesn't mean it should be done. This is how medicine works.
All right, on that topic, let's bring another one that's overused: high blood pressure medication. Talk to me about that.
I just, it's funny because May was a big month because I did 2 YouTube lives. One was on it's Blood Pressure Awareness Month. It's also Women's Health Month. But anyway, here's the thing: when someone comes to my office, unless their blood pressure is like 200 and something, right? I mean, off the wall high, I say, okay, this is what we have to do. We want to work on lifestyle, and I tell them, weight loss and exercise are your two friends here. I mean, this is a known fact. If you lose, for every pound you lose, okay, you'll lose 0.5 millimeters of mercury in your blood pressure, both systolic and diastolic. Let's say you lose 10 pounds. Well, your blood pressure would come down 5 points. Let's say you lose 20 pounds, which a lot of these patients need to lose, right? Then the blood pressure come down 10 points. That's as good as most medicines. But is it employed? No, because doctors, I didn't have any training in this either. It's just my interest. And because I do walk the talk, I mean, I like to be a role model. This is how I do things. But yeah, they go right to meds. They go right to meds. I had a gentleman, very interesting. This guy, he's a new patient, doing a great job. He's a film producer. He came here from Trinidad. Black, right? Diabetes, hypertension, obesity, all that runs in the family. So he goes to the doctor. His blood pressure was like not off the wall high, but it was elevated. He immediately put him on not one, but 2 medicines. And so when we do that, what we're telling the patient, we know you can't do this on your own. So we're just going to give you a little help and put you on some medication. That's not patient empowerment. That's disempowerment. And this patient came to me, found out about me through some source, and I said, okay, let's work on lifestyle. Now, this is several weeks later. He's lost 30 pounds. He's in the gym 4 days a week. He is off both medicines. And he's so happy and so grateful. But I didn't really do anything other than really encourage him. He had the desire to work on that. And that's the kind of patient I want to see. I don't need any more gunky artery syndrome patients. I've almost 40 years experience dealing with that. Like enough already, because this country is not getting healthier. It's getting worse. And, so that's really what it's about. So weight loss and exercise, probably in that order, will really make a difference. I can make a difference. Yes, there are sometimes we do have to use medicines, no question about it. But I don't go there first.
When you test cholesterol, do you do your traditional cholesterol test, HDL, LDL, or do you do the, go further?
I go way beyond that. So I do what's called specialized lipid testing or specialized cardiac testing. So the 2 labs that I really like are Cleveland Heart Lab, which is now, they were bought out by Quest about 7 or 8 years ago, and also Boston Heart Diagnostics. Why do I like them? Because you get a much more broad perspective. First of all, you don't just get HDL, LDL, triglycerides, and total cholesterol. You get the LDL particle number, and what's more important is the particle size. And all your audience has to know is bigger is better. Okay, and I tell my patients that. You remember anything about me, bigger is better. Because the larger the LDL particle size, the less likely it is to get oxidized and form plaque in your arteries. So we don't like small, dense. We like large, fluffy, or large, buoyant. And you can't tell that unless you do a specialized test. So these guys are just treating LDLs. They don't even know what particle size and particle number are, or they don't look for LP little a, which is a really significant risk factor for coronary disease. So besides the more comprehensive lipid analysis, they give me an inflammatory profile. I look for about 4 or 5 different markers for inflammation, because inflammation is what causes diseases of aging. It's not just the numbers. It's what's happening at the arterial level. Okay, then that gives me a metabolic profile, which is not just your blood sugar, but your hemoglobin A1C. How well has your blood sugar been controlled for the previous 3 months? Then it's like insulin resistant markers, and it's about 4 or 5 different tests that we look at. Why is this so important? Because 95% of the population in this country is metabolically unhealthy. These are the ones that will eventually become diabetic. Diabetes is on the rise. I think by 2050 they expect to be, I don't know, it's just, I forget the numbers, but astronomical. But don't take my word for it. What do you see outside? Obesity like we've never witnessed before, and it's not getting better. And I did some filming a couple of months ago, and I did my first post on Instagram. It was a couple of days ago, and I started off saying, "Did you know the average doctor spent 5 to 7 minutes in the room with the patient? Then they send you off." That's true. Surveys have shown that. I can't imagine spending 5 minutes in the room with the patient. It's just, I think when you develop a relationship with your patients, you have enhanced communication, and I would like to think better outcomes.
And I often mention that that's insurance driven, because the doctor has to run through how do you develop an understanding?
Absolutely. It's insurance driven. Insurance run health. They're purveyors of healthcare in this country. It's ridiculous. And patients have to realize they're going to have to pay out of pocket to get certain things done. Like I do, functional medicine testing. I do gut testing. I do adrenal testing. Those aren't covered by insurance. They aren't. But if you want to, I do a lot of gut testing, because I will tell you about at least 60%, if not more, people that come into my office for a heart-related problem also have a gut problem. And you don't know unless you test. Test, don't guess.
Just for clarification for our listeners that always think that cholesterol, that number is important to get, and then Peter Attia, who is now popularizing, get the cholesterol low, as low as possible, or as early as possible. Do you feel the same or differently about that?
No. Again, I won't treat anyone with cholesterol-lowering medication unless I've done a full cardiac, like I said, those advanced panels that I mentioned. I want to know again, I'm interested in the actual risk, not the numbers. But most doctors aren't like me. They're just going to treat. Most cardiologists don't do the testing that I do. Again, because it's insurance driven. And now I got in trouble. Well, they want to. Not got in trouble. So I used to get these notices from Blue Shield, or maybe it's Anthem Blue Cross. You're ordering too many advanced tests. Why can't you be like every other cardiologist? So I have to write this letter saying, okay, what I do is functional medicine and integrative cardiology, and they don't know what that is. I'm dealing with a bunch of idiots, right? But I have to validate what I do so they'll get off my back. Now I haven't gotten a letter in about 2 years, so maybe they just finally accept me, because I order a lot of these tests. And they are covered by insurance, but insurance they don't want to pay for it. So they call the doctor and tell me, hey, stop it already. Do you think I could give a hoot about what the insurance company, the money they were making by basically being the head of health? It's just, it disgusts me, really. It's like you say, it's insurance driven, and the patients end up being the losers, which is why, and I tell people in everything that I do, it's your body. You have to be involved. You have to make health your number one priority, because without your health, you have nothing. And if you expect your insurance company or the federal government to take care of you, it ain't going to happen. Not now, not ever.
So glad you're saying that. That's such an important point that they're not really interested. They're interested in their numbers and their volume, not what's good for you or not. But anyway, I do have a curious question about regenerative medicine and your
Yes.
tissue regeneration, like in situ for heart disease. And could you comment more on that, please?
Yeah, first of all, I really believe in regenerative medicine. I think there's a real role for it. Unfortunately, this country, again, is far behind the times, okay? When you compare it to Europe and the Caribbean, Brazil. I mean, I'm a stem cell junkie. I've had stem cells in both shoulders. I tore both rotator cuffs with years of lifting and abuse in my shoulders. My right shoulder was like full thickness tear, and this is close to it. And so I decided to do stem cells and follow up with PRP versus surgery. I got great results. Okay, I was back in the gym in 10 days because exercise, which causes inflammation, actually aids with the healing. Someone said, "Well, how do you know you didn't do another MRI?" I said, "It doesn't matter. I'm not my MRI. My symptoms were totally resolved. I'm back at the gym doing certain movements I probably shouldn't be doing, but I'm able to do it." And so I really believe in that. As far as the heart's concerned, I've been studying this for years, like 12 years. In fact, at least actually, yeah, about more like 15 years. I was very interested in stem cells in the heart. Now, we have people that have myocardiopathy. Their heart muscle just fails, whether it's a virus, whether it's a vaccine, whether it's this, any number of things can cause it. Now, lots of times these will come back. They can repair over time, if a person has innate healing abilities. But sometimes they don't, and you end up with poor ejection fraction, and patients are very symptomatic. And now, there's been so many heart transplants around, right? But stem cells, you can actually inject stem cells, your own stem cells, directly into the myocardium with an ultrasound. I know it sounds crazy. It's been done in Caribbean. It's been done in Germany. It's been done, but it's all these years have passed. I finally gave up trying to. I was interested in really trying to get this done, but you have to have a lot of backing. I mean, I couldn't do it myself. There was a company that was interested in using me as a spokesperson. Why did I give? Oh, because they didn't pay me. That's why. But I still believe there's a great hope there.
Yeah.
But there's religious and moral things here with stem cells. I mean, really? This is using your own, especially because I use my own stem cells. My stem cells were extracted from my bone marrow, my iliac crest. It was not that difficult a procedure, and I was lucky. I had a good population of stem cells despite my age, and I like to think that because of lifestyle, and I got great results. But there's no reason why it's great for shoulders, it's great for ankles, it's very good for knees. And yes, it's not for everyone, but it's something that's worth looking at. The problem is that it's not reimbursable by insurance. So, a lot of people that otherwise would want to go that route are unable to because of financial reasons. Yeah, I mean, you look at all the money I spent on stem cells, I could have had cosmetic surgery by now. But I chose this instead. But I think there's great promise for myocarditis and myocardiopathy. We have to do something because I have several patients with heart failure. Then these people are on like 4 different medicines. That's not the way I like to do things, but without these medicines, they would be dead. That's when it is life-saving. But, it's not a great lifestyle. And, so I think we're missing a lot of opportunities here from a regenerative standpoint.
So you actually said that the stem cells for heart is done in other countries? It's actually being done?
Yes.
So, Dr. Terry, did you hear earlier that he said something about the vaccines?
Oh, yeah.
I know you're dying to ask that one question. Go ahead.
All right. We're seeing, and it's in the last couple of years, I've seen people drop from myocarditis, heart attacks, strokes, more than I've ever seen in my 35 years of practice.
Athletes, even
and we're asking, we've asked a lot of people on this show about the COVID virus or coronavirus, and we've had some people say, well, it's because the virus weakened the heart tissue and it weakened the gut, and it's causing this long-term comorbidity. It's causing this long COVID, all that. And then we've had other people say, well, it's due to the mRNA vaccine that is causing all these issues, and that's the cause. And we have some people, anytime somebody drops dead, oh, they got the jab. And then we have other people that somebody drops dead, oh, they must have had long COVID. We've had people, nutritionists, going, oh, we can fix long COVID just by looking at magnesium levels, looking at this levels and all that. So I want, from a cardiologist standpoint, I want your opinion of what's going on these last couple of years.
Well, actually, you have to almost go back to the whole pandemic, because the pandemic, I think, caught all of us by surprise. Now, I, for one, did not shut my office down even for one day. A lot of cardiologists did. Okay, so I stayed open the whole time because I felt that my responsibility. I chose this career, this profession. But they scare the hell out of all of us, because remember, before vaccines, okay, what were we told to do? Wash hands, wear a mask, and socially distance yourself. And I think those alone did a lot of damage, especially the social distancing, and all gyms were closed. Okay, and as expected, I think probably close to over 30% of people gain weight during COVID, and the average weight gain is 26 pounds. That's a lot of weight, okay? Because staying home, making bread and brownies and so forth, you couldn't work out. But more important than that, what really got me angry is that I said, okay, if this is really happening and people are going to die of this illness, this pandemic, what are we doing about their immune system? There's got to be an immune problem, right? And yet, it took Fauci like almost 10 months to say, yeah, there is a role with vitamin D. Like, are you freaking kidding me? I came out with my own supplement about 4 weeks after after the pandemic was declared. And I said, I got to do something. It's called Immunowise for HeartWise. And so it has vitamin D, of course. I should have reviewed vitamin. I have a few supplements: vitamin C, vitamin D, zinc, and a couple other things. But the important thing, we were really directing the immune system, and I was being proactive and encouraging everyone to take this. And then all of a sudden, the vaccines came out. Now, the vaccines came out in December of that year. Now, I had to get them because I'm at the hospital, right? So I was in the first, and then I was like, good ho, vaccines are the answer, because I was tainted by all the press and everything that was happening. As doctors, we were, it's like you aren't taught to be an independent thinker in this profession. You're taught to just follow through, follow the rules. And I actually almost did for a while. And then I would say, you didn't get a vaccine? Well, why not? I was like almost judgmental about it, which is not like me at all. So the system was actually encroaching upon me. And then I started seeing problems. And, so I had the vaccines, okay, and I had 1 or 2 boosters. I'm not getting any more because I developed COVID twice. Even with being on avian vaccines, I didn't have long COVID. I had very mild cases and so forth. But, so my last one was, the booster was September of 22. I haven't had one since. And I don't plan on getting another one because I don't think it, I think, first of all, that you don't even know what to believe. All these deaths that took place in the hospitals, did they really die of COVID, or did they just test positive for COVID and they died from heart disease? Or, you know what I mean? The information that was gathered was very, very, it was cryptic. You couldn't figure it out. So did I see many I saw a couple of young people with myocarditis. Fortunately, did heal. Now, what's my feeling now? I will believe if a patient says, I took this vaccine and this is what happened to me, I'm going to believe the patient. Even if it's a low likelihood, if it happens at all, it's a complication, and I'm going to believe the patient. So I never question anyone whether they should or shouldn't do a vaccine anymore. It's an individual choice. But I think there's plenty to be skeptical about. I was very on top of this at the beginning of the pandemic, and was for a couple of years. And then I had to, take a little bit of back seat because long COVID and this, that, and the other. And I've treated a few long COVID cases. I do IV nutritional therapy in my office. So we did a lot of things like that. So I don't mean to have a convoluted answer, but it's confusing. And I think the average doctor just tells you what the whole thing. I mean, it's, the government says this, we should do that. And as in charge of healthcare, we're going to do it. Now, I question that belief completely. So,
well, yeah, especially with the fact that, even earlier you were talking about even a vitamin supplement or I think you were talking about a statin, and you said one size does not fit all, and I thought, ooh, that is the vaccine. They think that one size fits all, and we know better. That was we, as chiropractors, we were related to that as. So I guess everybody should get their neck cracked, right? No, we have, we discriminate between conditions that we find after an exam, but now they're, vaccinating everybody with the same thing,
Yeah, exactly. So I understand the confusion, and I think everyone's confused, health providers all the way through patients, and I think a lot of bad was done. The whole I saw elderly people have panic attacks and insomnia for the first time in their lives because they couldn't leave their house, or they couldn't see, you know what I mean? Or you had to, you had to say hi to your friends. And I had one lady, she had a best friend. They used to walk together every day. Now they would meet, and for a few minutes, like 3 or 4 times a week. She's in one car, she's in another. They don't even get out of the car. This is what it did. Because people were living in fear. And I think that's the worst thing.
What's interesting is that Dr. Terry and I would talk about, what you deal with out in California is very different from what we had here in Florida. There was a lot more. I mean, people were allowed to go to the park and do their exercises in the park. Dr. Terry was telling me that they had cops at the park saying you can't come in here, right?
Yeah, you're right. We were the. Yeah, Florida, because both of my sisters live in Florida, and my mother lived in Florida, so my brother moved her out here to California. But so I was very familiar with what was going on there. So,
very different. Yeah.
I don't place demands on people, or I think I've become a lot less judgmental. But it really started to affect me. I was becoming like, well, you got to get a vaccine, and what was it based on? One size fits all, right? Or you got to do it, or you'll die. But the people that were dying weren't healthy to begin with. I mean, this really struck me. It was when there was this one African-American man, he early on with COVID, was intubated for like weeks. I mean, he barely survived. So here we are. They're taking photos of him outside, getting ready to leave the hospital, and because he survived, right? And what's in his lap? A box of Krispy Kreme donuts. I mean, really? What could be worse than that? So, and they're publicizing this like, well, he's a survivor. Yeah, but look what you're promoting. This is what got him in trouble to begin with. He was diabetic, hypertensive, overweight. I won't go into whether the government's trying to depopulate the population. But it's a whole different topic, which I won't go into. But it makes you think, right? I mean,
yeah. Well, now, I wanted to ask you, there's a lot more information or studies coming out now that were censored back then, and it's pretty enlightening. Some of the things. Have you read some of that stuff?
Yeah, I have. It's scary. I mean, Suzanne Summers, who recently passed away, was a friend and also a patient of mine. I can say that now since she's no longer here. But she promoted bioidentical hormones after the Women's Health Initiative came out in 2002. Anyway, so she's at this convention as a keynote speaker, and she's with these people at a bar, and they offered her a drink. And it was from a pretty well-known big pharma group. Anyway, she ends up passing out, and she had I forgot the poisoning, but she was poisoned. And and she survived. They brought her to the hospital, and she was like close to respiratory arrest. But I mean, she wrote about this in one of her books. So you have to be very careful. I mean, I have to be, because they'll go after doctors, and there are these mysterious deaths. There was a very well-known alternative doctor, cancer doctor. Okay, Suzanne knew him quite well, and I didn't know him, but I had a couple of my patients that were followed by him. Dr. Gonzalez, I think. He was in New York, Manhattan, and this guy was mysteriously dead one day. No one knew why or how. No autopsy was done. I mean, so
I've heard these stories.
If you're too much, don't mess around with the establishment. So there's a fine line, I'm careful about, I don't try to diss the government or the FDA, but we know that there are things going on that are scary, and I think censorship is the beginning of it all. Yeah. When you censor things. But they want you to hear, I'm glad you guys heard about this. They want you to hear, I think it was last week. So the government hired a bunch of scientists. That in itself, to me, is suspect. The government hired a bunch of scientists. Who are these scientists? Where are they from? What are their expertise? But anyway, what was the statement? That processed foods are not that bad for you.
Yes.
Did you guys hear that?
Yes.
Yeah. Oh, yeah.
You got to be kidding me. Yeah. So let's keep promoting, because who is supporting these people? Usually it's General Mills, Sara Lee, McDonald's, you name it. There's all these companies that, I profiled on Instagram. I did some research on McDonald's French fries, which I won't eat. But I thought, okay, French fries, good, bad. You got oil, potatoes, salt. No, there's like 26 ingredients, okay, most of which I can't pronounce or spell. That's just one example.
Yeah, there's a well-known newspaper that even said donuts and sodas for kids is not that bad. It's like, what?
Yeah.
So, yeah, I agree with you. It's
See,
crazy.
we're perpetuating a very ill society. We're like number 35 on the longevity chart. Now, this country spends more on healthcare than any other civilized country, and we're like 35. That's how, and our lifespan is going down. Well, there's no wonder. It's lifestyle, it's diet, it's lack of exercise. Kids are not. When I was a kid, we came from school, we went out and played ball on the streets. Yeah. Until dinner time, we'd have dinner, we had to do our homework. If we were lucky, I would get 30 minutes of TV time, and there were only 3 channels at that time. That was life. It's not like that. Now kids aren't doing anything unless the parents slept, and both parents are working. I see kids, out on a plane trip visiting my daughter, my grandchildren a couple of weeks ago. This kid is on a phone. The kid could not be more than 7 years old. And they've already shown that screen time in a developing brain is like really bad. And the parents and they said, well, it keeps them quiet. Really? So this is what we're seeing. We're not a healthy country, and that's why. See, what I do, guys, I feel it's a calling that I have now. So my book was really about my story, and then it became, well, what can I do to give back and to promote health, and that's to people to become their medical advocate. And that was like a calling, because I'm not trying to stand out. I'm just trying to do good.
Very good. So, you touched off on stress. I know that stress has such a profound effect on cortisol levels, which is such a negative effect on the body. I mean, what else are you doing or advocating to reduce stress? You actually said earlier that you meditated. Are there other things that you advocate?
Yeah. I've done a couple of YouTubes on this. I think I really have I'm really into the vagus nerve. We don't need any training in fight or flight, right? Sympathetic. We're all living in a world of sympathetic overdrive. So we don't need any more training on how to run from a saber-toothed tiger, right? But we don't know how to relax. And so the vagus nerve. There's even a device that I've used called gamma core. It helps stimulate the vagus nerve mechanically. But but there's exercise you can do. I profile these exercises on YouTube. But we need to, because the vagus nerve is the longest of the cranial nerve. It's the only one that goes beyond the neck, so it goes to all your visceral organs. So when I think vagus nerve, I think rest and digest, rest and digest, and that's what we are doing. We're eating faster than ever, and come up from a Jewish background, I can tell you that's how we lived. Right. I mean, it takes 20 minutes for the gut to tell the brain you've had enough, right? We don't wait. So I do that. Like, let me give you an example, though. So a woman comes to me yesterday, lovely lady, educated. She has all these extra beats. We call them premature ventricular beats, which are usually benign. So she had 3,300 like 2 years ago. So her cardiologist, who's supposed to be integrative in Burbank, said, let's do another one. So she only did it for 24 hours, and she had like 60,000. So she said, I've never seen anybody with these many PVCs. We've got to put you in a beta blocker. I want you to see an electrophysiologist. And she said no. So somehow she learned about me. So I spent a lot of time with she and her husband. She's got 5 kids. She works full time. Her father, she was the only child, passed away of COVID 2 years ago. She was a major caregiver to her father. I said, you're going through grief. You haven't finished yet. And she said, yeah, and she started crying. I said, you've been through hell and back. I said, your adrenals are probably shot. And so what am I doing? I'm doing adrenal testing in her so we can get an idea of what's going on there, and also gut testing, because I guarantee you that her microbiome has been altered. With that much stress, you can't maintain a normal microbiome. And that there's a definite gut-heart connection that we are finally getting. I look at the gut when I can't figure out what's going on. Like, as functional medicine, we're going to keep searching till we find something. The gut is oftentimes the answer. So she worked out, and she felt so relieved that I'm actually trying to identify a cause for her than just put her on medication. I mean, she has a blood pressure of 98. She's very healthy. She's going to feel like, I'm not going to say the word, she's going to feel like crap when she's put on this medication. And seeing another doctor for an electrophysiological study, PVCs are relatively benign. Okay, so, better than to treat, let's figure out perhaps why they're there. That's the approach I take. And once she comes back and we figure out the stress, then I will sit down with her and teach her how to breathe. That's one thing I do. I sit my patients down and say, let's work on breath. There's box breathing, then there's the Elkin method. And the Elkin method, which I like better, is inhale, for 4 seconds through the nose, hold for 2, say to yourself, 1001, 1002. Let it out on the count of 6. In for 4, hold for 2, out for 6. And I put my teeth together so I hear actually a hissing sound. So it's, I kind of like the audible sound, but more important, people get excited, they forget how to exhale. We're always going to inhale because we can't live without oxygen. People trap oxygen in their lungs, and that leads to hyperventilation and other things. So I know I'm probably one of the few doctors that actually teaches people how to breathe, but I can't just do a test and say, I got good news and bad news. The good news is that your heart's fine. All the testing is normal. The bad news is that you have to live with it. Who in the hell wants to live with pain, whether it's physical, emotional, or whatnot? So I feel like also part of what I need to do is I teach people how to breathe, and we do it together. I'll spend like 10, 15 minutes going over breathing now. Now you do it. Now let's do it together, and then I want you to do it and demonstrate to me. You say, I want you to do 10 of these the minute you wake up, 10, and then at the end of the day, when you're back in bed, 10 before you go to bed. And if they're overweight, I'll have them do 10 before they have a meal, because they'll lower the heart rate, the blood pressure, and they'll probably eat less.
So good. So good. You're definitely a rare breed. So, we're going to wind up with one of our favorite parts of the show. It's rapid questions that we ask you. There's 5 of them, and we look for quick answers. it's answers you already know, but they're fun questions that go deeper than some of our conversations that we just had. So if you're ready for question number one,
Sure.
I'm ready to throw it out there. You ready?
Mm-hmm.
All right, here we go. We understand you were a competitive bodybuilder, and you also took singing lessons, and you have a voice, from what we
Yes, I
understand.
did.
So, two ends of the spectrum here. What is another thing that you love that would surprise most of your patients?
I'm also a trained dancer.
There we go.
And now, I want you to know that I had to take it back because of the nerve damage that I've incurred, and I've had a second back surgery, which I did not really want to have in January 3rd of last year. And basically, I have not really. And then the surgeon wants to do a third surgery with putting rods and buttresses. Done. No more going down, diminishing returns. But I don't give up. I'm like a pit bull. Said my dance instructor, who is a dear friend of mine, she's professional. She says, Howie, we don't give up. So, yeah, I dance and I sing.
That's great.
You know
Question number
what?
two.
What's so important about it? When you are doing these activities, you are in the moment. You can't be thinking, obsessing about other stuff when you are singing, dancing, or lifting weights.
You're absolutely right. You're absolutely right. I love it. Question number two. From your experience, what is your best tip on how to deal with other doctors?
With other doctors?
Yeah.
Okay. This is a great question. Well, you have to ask yourself, is this the right doctor for me? Like a patient, I've seen patients come in with a shopping bag of supplements. I mean, I'm saying, whoa, you can't be taking all that. Well, I am. You must have the most expensive urine on earth. No way can you be absorbing all that. But then I'll say, does your doctor know you're taking all these supplements? Oh, no. What do you mean? Oh, if he knew I was taking all these supplements, he would fire me. I said, who's hiring who here? Patients don't think they have any rights. And I have a whole patient bill of rights that part of my book, it's in there. Right before I talk about the details of being a medical advocate. If it's not a good fit, find another doctor. Why settle for someone who's got all these great degrees on the wall? If they aren't for you, if they don't believe in your philosophy, if they don't believe in holistic health and lifestyle management, get out of it. Divorce the doctor and find another one. That's how you deal with it. Because you know what? You can't change people. Most doctors are set in their ways. You were taught in medical school to not be an independent thinker. So they get out, and then they're dealing with all the insurance stuff. They're not going to bend. So you have to bend as the patient. You have to do what you can to be your own medical advocate, and you have to choose the right medical provider for you.
Right on, right on. Question number three. If you could pick one thing, what would you like to be remembered for?
I think what I'm doing now, I think it's a calling. See, it makes me feel emotional about this. It's a calling to let people know that they deserve more and they can get more, but they have to take charge of their health. I mean, if I can get that, if you look at my the last video I did on Instagram, it sums it up. It just sums it up. So please look at my last entry. So that's what I'm remembered for. Not that I'm a great doctor or a good bodybuilder or a father or grandfather. Those are all important, but professionally, I want to be known as someone who really cared, who really went out of his way to tell us that there's a better life out there if we take charge.
Oh, man, you got me all choked up too. Jeez. That was great. Great answer. Question number 4, if you have done a lot in your life, what is one thing on your bucket list that you still strive to accomplish?
Movement. Okay. I live with an infirmity. The second surgery did not really help. I mean, now here's the good part. I have no pain. None.
Oh, good.
Probably no one can understand with an MRI that looks like mine why I have no pain. I personally think it's because I've been so proactive in exercise. So I have no pain. I'm not showing deteriorated neurologic symptoms, but I struggle with balance and going up and down stairs. There's certain things that I can't do like a normal person would too. And you look at me, you would never think that, because I'm in such good shape and I'm supposed to be this paragon of health. But I have my own struggles, and I'm dealing with them, and not, because I want to stay strong and be a good role model. But I have my own flaws, and that's one of them. And it's, I've done everything I can. I chiropractic again. I'm in a chiropractor yesterday, and physical therapy, and I dance twice a week, even though it's not like I used to. I'm pretty good. I lost kind of contact with the floor, so I'm trying to reestablish my relationship with the floor. So that's where I'm trying to. I'm still striving.
Oh, I have one more question, and then we're done, because I feel the emotions pouring out, and that's what we love to hear. Your best question number 5. Your best tip for our audience to start your day. What would that be?
Listen to your body. And the reason why, when I wrote my book, the first chapter, I was anything but my own medical advocate. I was a typical male. I wasn't even a doctor. I didn't even notice my own symptoms. I was so out of touch. So know your body. Your body will not lie. If you feel something and it doesn't feel good, get it checked out. And if you don't get the right answer, keep checking. You'll find functional medicine doctors. I'm not the only one out there. I sometimes say, why am I the only guy in town? I don't do anything that's special. And they said, no, you are special. I said, but it shouldn't be this way. So, but keep searching. Don't give up. Do not give up. And you will find an answer.
On that, Doc, we're going to close because I know you're busy, but you are special, and I'm so glad that you're part of our Cracking Backs family now.
Thank you.
I'm going to put in the description for the show. I'm going to put ways to find you, ways to buy your book. All that stuff will be in your description. And because I want people to find you, because you are special, and I think your legacy will grow on because of what you're doing. So this is what the show is all about, and we're so happy that you share your story and to help other people get healthy.
And we did it all unscripted, right? How great is that?
Yeah, man.
Isn't that great?
It was perfect. You really, as a cardiologist, you spoke from your heart. No pun intended.
Yeah, that's
Thank
right.
you.
You guys know, you have you know how to get in touch with me, right? As far as
I do.
Okay.
I do. So we'll make sure all that happens, and you have a very blessed day.
Thank you for listening to today's episode of the Cracking Backs Podcast. We hope you enjoyed it. Make sure you follow us on Instagram at Cracking Backs Podcast. Catch new episodes every Monday. See you next time.